As Omicron cases in India have crossed 200, Centre has issued an advisory to states warning that Omicron is 3 times as infectious as the Delta and war rooms are needed to contain it. The Centre also listed a series of prevention and containment measures that included extensive testing, night curfew, regulation of gatherings including marriages and funerals. The Centre has also directed states to use emergency funds to increase hospital beds, ambulances, oxygen equipment and medicines. All clusters of infections should be tested for Omicron without delay. So currently there are 213 known cases of Omicron in the country. 11 more patients were found in Maharashtra. Of these, 8 were found through screening at the Mumbai airport. Until date, a total of 65 patients infected with Omicron variant have been reported in Maharashtra, and of these, 34 cases have also been discharged following a negative RT-PCR test. Now, the Omicron variant is the dominant strain in a host of countries, including the US, Denmark, Portugal and the UK. The World Health Organization's top official in Europe has warned a storm is coming and that a surge of Omicron cases will push European health systems towards the brink. To talk more about this situation and what we know about this new variant, we're now joined by Dr. Fahim Yunus, Chief of Infectious Diseases, University of Maryland. Thank you so much, Doctor, for joining us on the program. Now, there's more and more news of Omicron spreading. It's the holiday season as well with Christmas and New Year's. What is your advice to people?
Yeah, my advice will be that the pandemic is very difficult to predict at this stage, just like stock market. You can't predict a stock market, but still all of us invest, or most of us still believe and invest in the stock market because we believe in certain principles. So similarly, there are certain principles of this pandemic which are important to keep you safe. And those principles are remain vaccinated, wear a high quality mask, and avoid gatherings where you feel there are high-risk people, and particularly if you're immunocompromised, then take extra care. But the life cannot come to a stop anymore. I don't think going back into lockdowns is a solution.
All right, so lockdowns is not the solution, but we are seeing some restrictions coming back in countries. We have travel bans in place. Countries are being placed on the red lists.
I don't think travel bans work anymore. Once again, 2020 March was different. It was a new virus. We did not have a vaccine. We did not have a treatment. We did not even have the knowledge. So today, almost 2 years into it, look at what we achieved with these travel bans, Gargi. Right now, Omicron is already present in more than 90 countries, and I think it's probably in another 50 countries if we test it enough. So we have to figure out safe ways and keep the messaging simple. And just because it's a new variant, we don't have to come up with a new strategy every time. We need to implement our old strategy better.
And now it's being said that Omicron causes milder illness. It doesn't mean it can't have long-term effects, isn't it?
Yeah, that's why I gave you the example of stock market. It's very difficult right now. There are so many variables that the results in one country could be different to another country. The result in one population, in one group of people, in one individual could be different based on so many variables have been introduced. Long COVID, to me, is still a big gray area. Good quality research has to happen. We need to agree on specific definitions. We need to do more case-controlled peer review trials. And with time, we will see long-term infections and long-term effects are known for every virus, nothing unique to COVID. But I just don't like to go to either extremes of that narrative. I'm not dismissive of long COVID, but I also think that it can be hyped up too much. So I'm avoiding both of those extremes and not trying to scare people from something that we just don't understand today as well.
Right. Dr. Yunus, there's also, news coming from the United States that monoclonal antibody treatment, something that was, found very promising, that it's not working against Omicron.
Sure, multiple monoclonal antibodies have been a good addition to our armamentarium, and 2 of them at present seem to have lost their efficacy to a great deal. That is true. At the same time, we feel our vaccines are effective. We feel it still remains a respiratory virus. And I'll tell you, there are 400 or 500 people in my immediate circle in the city where I live 98%, 99% of them are vaccinated. Almost all of them are following the masks and the guidelines, and I haven't seen any one of them getting infected through the Delta wave or the Omicron wave right now. Of course, this is my own personal experience, but what I'm trying to emphasize is that the same principles are working against this variant that they're working previously against Delta and other variants.
All right, you spoke about, vaccines and how they're working in India. We're yet to start a booster program for the vaccines. There's a lot of concern about that. There's a lot of clamor for it. But at the same time, we haven't been able to vaccinate a majority of our population either.
I know, very difficult decision. Every country has their own challenge. They have their own. It's very difficult, very easy actually for me to comment here from America as to what India should do. I personally think this is a difficult decision. I won't get into the policy. The science is pretty clear though, Gargi. The science is that the current state, Omicron will pierce through the two vaccine strategy. People will get more breakthrough infections, and if they have immunocompromised illnesses, that they will end up in a hospital. We know that for sure. A third dose will help rebuild that immunity, will improve protection. Now, how do you distribute it in a country like India with that scale where you still don't have nearly, even not even near 70 or 80% vaccination? So that those strategic, difficult questions, I will leave it up to the locals to decide. But the science is pretty clear.
All right. Well, thanks for that. And also, should vaccinating teenagers be a big priority? We haven't started that here either.
Right. So when it comes to children, there are a few things we know and some we don't. As far as children under the age of 5, their risk of hospitalization or death has not actually been higher than previous flu seasons here in America, which is extremely reassuring. I think international data also supports that the risk to children, thank God, has not been more. So I'm less worried about that small population. I think schools, I agree with a lot of experts. They should be the last to close and first to open. We adults have to get our act together, and our children don't have to suffer for our mistakes.
Doctor, so finally, what do we know about the severity of the disease called by Omicron? There's so many different studies claiming different things. Some claim it's as severe as Delta. Some claim it's milder than Delta. So what do we know?
So we know that the transmissibility is high. We know that it is doubling from 1.5 to 3 days in multiple countries. As far as severity is concerned, I'm one of those who feel it is not more severe than Delta, but I'm reading the same studies that you're quoting. I don't think we have enough long-term good quality data. What we do have is a very clear decoupling. You can all go on Google right now and find out the number of cases in Denmark and the number of deaths in Denmark, the number of cases in UK and the number of deaths in South Africa. And you'll clearly see in previous waves, as the number of cases rose up, the deaths followed. That's not happening this time. Number two, these peaks are not lasting as long. They're actually dropping pretty quickly. All of that is good. I don't want people to become complacent though, because what may be happening that this time the hospitalizations will increase, even if it does not cause death. By the sheer number of new cases, it can overload the systems, where you don't want to be in that same crisis situation again, where we can't find oxygen for people. And understand that resources in a hospital are used by all the people in the community, not just COVID. We don't want to see people dying of a heart attack on the street because the hospital was full. And those are the things that I'm worried about, that overload of the hospitals, but I'm not as worried about the severity of this Omicron as of today. Of course, things can change.
Right, that is the challenge, overloading hospitals and people with other diseases getting neglected. So it's very worrying for us currently, watching what's happening in the United States and the UK, and there are fears that there could be a wave here early next year.
Yeah, there's nothing good about Omicron or COVID spreading. So no one should think that there's anything good about it. But in terms of US, I just again want to reassure people, unfortunately, in US there are two different pandemics. One is a pandemic of the unvaccinated. That's what's fueling all the numbers. I work on the front line. 70-80% of all our patients are still unvaccinated. The other 10-20% who are vaccinated were either old or had cancer or were on immunosuppressive drugs or had underlying conditions to explain it. The vaccinated people are largely protected. So I cannot emphasize this point enough that what we are, and I believe every media story should lead with that data point. Anytime we're talking of a curve, we should talk about what percentage was vaccinated versus unvaccinated, because we have to give reassurance to those people who are following the science, who are doing everything right, who are otherwise healthy, and we cannot paralyze them with this broad narrative, broad brush narrative. Cases will continue to go up, but I think there is clear dichotomy on the ground that people like me on the front line are seeing. And that to me is a reassuring for at least all those people who are doing the right thing.
All right, Dr. Yunus, thank you so much for speaking to us here at NDTV.